to the Winterhaven Chamber of Commerce Ask the Doctor series. This series is done in partnership with BayCare's Winterhaven Hospital to provide you, the community, a chance to get to know our local physicians, as well as the many services that Winterhaven Hospital provides to keep our community healthy and thriving. On today's episode, we speak to Dr. Rosa Joseph, who is board certified in family medicine and serves as a core faculty physician for the Florida State University College of Medicine Family Medicine Residency program at BayCare. We talked to her about her experience growing up in Winterhaven and now being a part of the amazing growth that's happening in our community, as well as the services that the Family Medicine Residency provides. Well, Dr. Joseph, thank you so much for being on the show today.
Of course. Thank you so much for having me. I'm super excited.
Yes, we're so thankful that you were able to take the time to chat with us, to tell us a little bit about yourself. And that's actually where we usually start a lot of these interviews, is having you tell us about yourself, how you came to Winterhaven, a little bit of your educational background, and anything else you'd like to share.
All right, awesome. More than happy to do that. So a little bit about me. I'm actually from Winterhaven.
No kidding.
Yeah, so I was initially born, originally I'm from St. Lucia, but we moved to the States when I was 9 and moved to the Winterhaven area. So I grew up here. I went to middle
Wow.
school at Jewett Academy, high school at Lake
So did
Region.
I. Oh, that's
Really?
funny. Love
Oh,
it.
that's awesome. And so, yeah, so then after high school, I went away and I was gone for a while. And then this job presented itself. And I mean, literally the moment I interviewed with Dr. Falk, who's the program director, I was like, this is the job I want. So I did my undergrad at Stetson University. I then got a master in public health degree from the University of South Florida. And then after that, I got my Doctor of Osteopathic Medicine degree from A.T. Still University, which was out in Arizona, but I actually did a lot of my rotations and stuff in DC. After doing that, I returned back to Florida. It was definitely time to come back. And so I did my family medicine residency at Ascension St. Vincent's in Jacksonville, Florida. And then I did a 1-year fellowship in women's health and obstetrics with Advent Health in Orlando, Florida. And I just finished that in August of 2020. And I started here with BayCare and FSU in September of 2020.
Wow, that's amazing. So how has it been? You know, you're the first doctor that I've spoken with that's actually kind of from here, since you were young. So what has that been like, growing up in Winterhaven and now working here and actually leaving and coming back? How has that process been?
So it's actually been really awesome. Winterhaven's definitely changed in really exciting ways. I personally think, at least.
I agree.
Growing
I
up,
definitely agree. I'm a little bit biased, but
yeah, I know, but I honestly love it. I'll be honest. So I didn't initially think I would come back to Winterhaven, and I looked at jobs elsewhere. But like I said, the fit it just seemed like the perfect fit to me. And being home, being closer to my parents, was definitely a plus. And I just love all like the growth that Winterhaven has had. It's been really exciting to see, and then be back and be a part of it. I definitely want to find ways to get more involved in the community again. So that's something I'm slowly trying to do and work on. But overall, the transition for me wasn't a difficult transition, because at the end of the day, it is home. But it's been really nice just to see the growth overall. I love doing things like the farmers market. There's so many different new restaurants, and I love trying new restaurants. So
absolutely.
that's been a lot of fun for me as well. And it's been really nice to just running into people that I grew up with, and maybe we haven't talked in 10 or more years. So that's been really great.
Well, it's really cool that you were able to grow up here and obviously see the growth, which Winterhaven is experiencing a lot of growth right now.
It's really so great.
Yeah, and I mean, even the health sector in itself is growing and booming here in Winterhaven. So it's cool that you've been able to kind of see all of the ways that Winterhaven has been blossoming and be a part of that, with your occupation now. So that's super exciting.
Yeah.
What sparked your passion for medicine? Was there anything like, was medicine always the goal, or did you have other goals when you were younger of what you wanted to do when you got older?
Yeah, medicine was not the goal. I don't know exactly when it happened. I for sure thought I was going to be an English professor.
No kidding.
I really liked English. So I started college, I was an English major, but then my senior year of high school, I actually took a psychology course. And then I was like, okay, I really like psychology too. And in doing a psychology course, I had to take like a science course with it when I was in college, since I
Mhm.
also had, so I was an English major and psychology major. So I had to take like a science course with it. And then I was like, oh my God, this is so cool. Um, and one thing led to another, then I'm volunteering in hospitals, and it took me a while to get there, because then I also thought, I'm not going to go into the whole story, but then I thought I was going to get a PhD in public health, but I thought solely research wasn't something I wanted to do. And so my passion in medicine was kind of sparked late in undergrad and while I was getting my master's degree. And then that's when I went on to medicine. And it sounds really cheesy, but it almost feels like a calling, because even when I would try to stay away from it, it would just like pull me back in. Like I remember I actually used to shadow Dr. Elizabeth Griffin. She was my doctor at Gessler Clinic. And so that's who I would shadow. And I would always like really enjoy it. But I think I still had this fear to enter medicine, because you always hear like doctors don't have a life, doctors can't have a family, et cetera, et cetera. So I was like, maybe I don't want to do this. But every time I tried to get away from it, I was back in it. And it was really just where my passion was. So it got to a point where I couldn't see myself doing anything else.
Mhm.
And here we are.
Well, I would have to agree with that because somebody like me, I mean, I don't know what would have to happen for me to become a doctor because there's a lot of schooling involved.
It is a lot of
So it's
school.
obviously a huge commitment. So it must have been destiny that you
Yeah,
were called to be a physician.
I sometimes really feel that way, because I'm like, I think back to it and I'm like, this was never, ever even a thought in my head. I never thought I would be a doctor, but it
Right.
turned out that way. Yeah.
Yeah, I was going to say English professor and doctor don't necessarily
It does
line
not
up.
go.
But that's
Uh,
awesome. That makes it even more special.
yeah.
So, how about you tell us just a little bit about your role at the hospital? What does your day to day look like, and all that?
Yeah, so like I mentioned earlier, I'm part of the family medicine residency program. And so as part of the program, one, I do have my own patient panel. So I do see patients of all ages. So that's the beauty of family medicine and what really drew me to it. So we see babies, adults, we do women's health as well. So we also do prenatal care, and then we see patients 65 and over. So I do that with my clinic. So I do have my own clinics a few days a week. And then other than that, I'm doing a lot of teaching with the residents. So the residents are also being trained in what's called full spectrum care. So again, that's seeing kind of all ages across the board. And so the residency, the patients, they precept with us. We also provide education in the form of presentations. And for we also will work with them with a procedure. So we also do a number of procedures at our clinic, from knee injections to shave biopsies of something on the skin that may need biopsying. So there's a lot that we do. And so my role particularly, in addition to seeing my own patients, I also work very closely with the residents in education.
So it's interesting that you were talking about how you wanted to be an English professor, and now you're kind of, on that line. The topic is obviously a lot different than English.
I,
But do you think that kind of that education piece was a little bit of what you were looking for, when you were in school and things like that?
Yeah, absolutely. I think I always knew I would end up in education, because I do enjoy teaching. I like enjoy mentoring. So the job definitely makes sense.
Yeah, it
And
seems to
so,
be right
yeah,
up your alley.
yeah. And
It's
so
a
at the
good
end of the
a
day,
marriage of the both.
it
So that's
is, it
cool.
is. Yeah.
So you said you do see some of your own patients. So what are some symptoms? Why would somebody come to your office specifically? Are there like specific symptoms that someone would be like, oh, I have this, so I need to go see Dr. Joseph?
Yeah. So they would, if so, things that we see in our clinic, we primary care. So if someone needed a primary care physician, which primary care is so important, right? Just Our biggest goal is prevention, trying to prevent from the bad things from happening. So someone with high blood pressure, we manage diabetes, we do well visits, so annual well exams both for children and adults. We also see patients under the Medicare, so for Medicare annual well visits. We also see patients for acute problems. So if they're sick with a cold, we would see a patient if someone has, like I mentioned earlier, like maybe some abnormality or something on their skin that they want to get taken a look at. Really, we truly do full spectrum here. And so so if a patient comes to us and it's not something that we are able to do, then we are able to be the ones to refer to the appropriate specialist as well. And in addition to all of that, we also provide prenatal care. So there are 3 attending, well, all of the family medicine physicians will do prenatal care. 3 of us do deliveries. And again, we do that with the residents as well. So they can
Okay.
also come here for their prenatal care. And what's really great, and why I love family medicine, and I'm sure most family med physicians here do, is once we see mom, we take care of her, we deliver her, and then we're able to see her for primary care beyond that, and we're able to see the baby as well.
Oh, that's really
Yeah,
nice. That's kind of
yeah,
a warm and fuzzy. You get to see it from,
yeah.
start to, well, not
Mhm.
finish, but the
Yeah, maybe
after of
finish
that,
isn't the right
which is
word,
really,
but
yeah, that's
yeah.
really cool. I love that.
Yeah,
And that's kind
yeah.
of probably a part of being able to build a relationship with your patients and
Yes, absolutely.
gain that trust, I guess you could say,
Yeah.
which is really important. And that's why people would probably want to stay with you because if you see them from the start, it makes it easier to come and see you and build that relationship, which is
Totally.
really cool. So how would somebody who's watching or listening come and see you? Is there a way that they can book appointments or anything like that?
Yeah, so to book appointments, they would actually have to call our clinic. They would just call the clinic and make an appointment that way. Just let them know that they're a new patient wanting to establish. And then we would be happy to set that up. We're located right across from Winterhaven Women's or the Regency. So our clinic is right there in town.
So I
Mhm.
know your experience has led you to kind of different places. I know you were at UCF or USF rather,
Mhm. Yeah.
and you've been able to kind of go to different areas. So what would you say is the best part about practicing medicine here in Winter Haven?
Honestly, it's just being back in the community. That's truly been the best part, to be able to give back into the community where I was raised. I've really loved the people being back here. I love the people I work with as well. I feel like I work in a really supportive environment. Um, and I mean, I honestly, and I'm not just saying this, it sometimes sounds like I am. I feel so blessed to have this job. And, training is for sure very difficult. So I remember during training, you have times like, oh, did I make the right choice? And so starting this job, it's like each day I'm reminded that, like, you know what, I'm definitely doing this for a reason and I made the right choice. And if I had to do it again, I would do it all over again the same way.
That's amazing. Yeah, being able to go away and come back and feel like you're contributing to the place that you grew up is really special. So, thank you so much for sharing all that. And is there anything else that you want to share with anybody who might be listening?
No, come check us out. We
Absolutely.
love providing, like I said, full spectrum care. We offer a lot here. The physicians here are great, very caring, and family medicine is what we love. And I think that definitely shows in our patient care.
Absolutely. And you are obviously a great representative of that. Your passion obviously is apparent in this interview. So we appreciate you so much taking the time. And hopefully you'll have some
Having me.
people knocking down your door to come and visit you. But thank you so much for taking the time, Dr. Joseph.
All right, thank you so much for having me. I appreciate it.